Hello, everyone. You are welcome back to this episode of our YouTube channel, where we dive into the most interesting issues that is affecting our mental health, our well-being, our body, our mind. We know you've been following us in our past episodes, but don't forget to subscribe, like, comment, and share. Today, we'll be looking at another interesting issues in mental health, and that is trauma. Have you ever been traumatized? How did you cope with it? If yes, how were you able to cope with it? If no, how well or what are you doing to get immune to trauma? Joining me today has always been a clinical psychologist and a neuropsychologist at the Department of Education and Psychology, University of Cape Coast, in the person of Dr. Daniel Nyanza. Doc, it's good to see you again.
Thank you for having me, Humphrey.
Yeah, Doc, there are a lot of issues that is surrounding trauma. Sometimes, people, go through the harsh moments within their early childhood experiences, growing up, feeling uncomfortable, depressed, and usually going through a myriad of mental health issues. There are people out there who are going through a lot, but they might not know their experiences is a traumatic one.
Right.
So in this episode, we want to really educate the masses out there in the world what is trauma. So since you've been practicing mental health as a clinical psychologist for long, we want to understand what trauma is. What trauma is. In a layman understanding, what do we mean by trauma, Doc?
Thank you for the question, Humphrey. So trauma, we are talking about a reaction, to a distressing event, or we are talking about the fact that someone is experiencing an unpleasant event or a negative event which is making them feel unpleasant. So when you are emotionally reacting to negative event or unpleasant events in your life, you are going through trauma. Sometimes you react psychologically too, right?
Okay.
So put simply, when you are going through a negative experience or a negative event and you are feeling unpleasant about it, you are experiencing what we call trauma.
Okay.
Right.
Okay. So, wow. So when you're going through a negative experiences or events, that means that it is having a persistent effect on your life for a longer period of time. Then that we can say the incident has been traumatic.
Right.
Okay.
It can be even a short period.
A short period.
We have acute trauma.
Oh, okay.
In acute trauma, you have it for a short period. We have chronic trauma. You have it for a longer duration. So it can be for a short period. It's still trauma. It can be for a long period. It's still trauma. The biggest thing about it is that you are going through a negative event, an unpleasant experience, which is very distressing to you, which you are not happy about, which you feel uncomfortable about. Then we are talking about trauma.
Okay. So, Doc, if an individual is going through the acute and then we have the acute and the chronic, as you just mentioned, are the experiences the same? Are the distressing experiences the same given such two people?
Of course, not the same, given that one is a shorter duration, which is the acute trauma. One is a longer duration, which is the chronic trauma. So the longer you stay in trauma, the more severe the effects of trauma on your mind, on your body, on your emotions. The shorter you are in it, the less severe the negative effects of trauma on you. So they are not the same. The experience is not the same. When you are going through an unpleasant experience for a longer time, it's definitely going to impact you the more. So the impact even tells you that it's not the same.
Okay. Okay, Doc. So, Doc, looking at trauma, what is actually the main cause? Is it that you have to experience an event? Is there any major cause to an individual to experience trauma? Or are there any traumatic events that trigger an individual to experience trauma? What is it? What is the causative agent for trauma?
Of course, trauma, the cause of trauma for every individual will differ.
Okay.
There's always a precursor for you to experience trauma.
Okay.
Something that happens before you go through trauma, right?
Yeah.
So that thing which happens to a person is what is causing the trauma.
Okay.
For example, when someone is being abused in a relationship, those who are being insulted in relationships, those who are being sexually abused, right? that will be the event that will traumatize the person, right? Those who are being beaten in marriages, those who are being bullied at school, bullied in marriages, bullied in families, those who are being undermined in the churches that they attend. There are churches these days who are traumatizing their members.
Wow.
You know, those who family members are fighting against, those who have experienced war. So far as it's a negative experience, what about those who have been diagnosed with a chronic health condition and they've been told by the doctors that, hey, this condition, we can't cure it, we'll just give you medications to survive to the point that you die. What is more traumatizing than that? So it tells you that even the medical setup that we have in this time is also causing a lot of trauma for their patient.
Wow.
And I can tell you for a fact that many patients are dying not because of the condition they were diagnosed with, but because of the information, the message that the medical professionals give them. This condition you are diagnosed with, you can't cure it, we'll give you drugs to manage it till you die.
Okay.
Right?
Okay.
Such messages, being diagnosed with such conditions, terminal illness, chronic illness, that there's no way to get out of, is also very, very traumatizing to many patients. And for that matter, being the main factor that kills them and not the condition necessary.
Wow. Wow, this is very insightful. So usual at times, so that means that individual now experiences traumatic issues basically could have their problems stemming from the medical side as well, just as you said. So that means that if I go to the hospital, what the doctor tells me and how it is being processed can have an influence to whether I'll be diagnosed or I'll get a trauma or what. So doc, that leads me to my next question.
All right.
If an individual finds himself into an unpleasant event, is it always automatically that person is on his way to trauma, or it is based on how the individual process that event?
Of course, the processing of it, the way you take it. If you've been sexually abused, right?
Okay.
More likely that is going to lead you into trauma. But of course, you'll be more traumatized if you process the information negatively.
Okay.
So the one who was abused sexually, for example, a lady abused sexually, a young lady, the way she processes it, this means I'm no more worthy as a woman. I'm not going to be the great woman that I've always thought.
Yeah.
The negative way of processing it will make the person experience the trauma the more.
Wow.
But the event in itself also is very traumatizing. But when you process it negatively on top of it, it worsens the experience of the trauma.
Okay. Yeah. So that means that two people experiencing the same trauma, based on how they process it, can determine whether they would have a traumatic, problem within their life.
I'll put it this way.
Okay.
Two people who have experienced the same traumatic event
Okay.
will experience the trauma differently.
Okay.
One will experience it more severely than the other based on how they process the event. The one that processes it more negatively is going to experience the trauma the more severely than the one that does not process it too negatively.
Wow. So that means that everything depends on how you tend to process events. So if an event happens to you, it depends on how you give meaning to the event, whether you'll be traumatized in the condition or not. We know that there are a lot of millions of people out there that have been traumatized, Yes, they are battling, a lot of mental health issues as well as trauma is of concern. So we want to look at what are some of the perceived effects, or what are the effects that seeks to impact upon their life with such individuals living with trauma.
So in other words, we are talking about the effects of trauma on a person.
Exactly.
We've come to the understanding that trauma can actually impact an individual mentally, physically, socially.
Okay.
In many ways.
Okay.
Right? Even biologically.
Okay.
So we can talk about many effects, like for example, in terms of their mental health.
Okay.
For many people, the biggest effect for them is the mental health crisis they go through when they are being traumatized.
Okay.
Because it's a negative experience, they go through depression, they go through anxiety. For some ladies who have been abused sexually, they fear that the one who traumatized them puts in them, if you don't know, and they say that I'm the one who did out. So they develop anxiety and fears because of that. They go through stress because the event itself of being sexually abused, which is traumatizing, or being given a diagnosis or being beaten in a relationship, will put you through stress.
Okay.
So in terms of mental health, they go through a lot, but these are the main ones: depression, anxiety, stress.
Wow.
Right? Biologically, going through trauma can impact on the way your organs function. For example, trauma is known to impact on the immune system, of people who go through trauma. Trauma is also known to be actually the root cause for many, many diseases. Excessive weight gain, becoming a type 2 diabetic, because trauma will put you under stress. When you are going through stress, you gain weight. When you gain weight, it becomes a risk factor for type 2 diabetes. So it's actually the root cause to many other health conditions, which we've not really known that trauma can be that, disastrous.
Wow. So that means that trauma has been one of the, sensitive issues in our world today. Wow.
Of course, and it can also impact your brain functions. People who are going through trauma in their marriages, in relationships, and so on and so forth, cannot even focus or concentrate when they have a work that they have to do.
Okay.
They see that they struggle to remember stuff that they want to remember. So the effect of trauma on also cognitive abilities or brain functions is also quite enormous.
Wow.
Yeah.
Wow. Trauma can affect your mental health. Not only your mental health, it can be triggers to a whole lot of medical illness, as doctor said, diabetes. So let's take care of our mental health very well. Okay, so doc, wow, trauma is a very interesting thing. So now let's look at the solutions, the interventions that an individual who is going through a traumatic, experiences, what can we do for the person, or what can the individual do for himself, or what coping strategy can be adopted for such an individual to be at ease with the trauma? As a clinical psychologist, what are some of the interventions you can provide?
Well, it's difficult for us to do an intervention on trauma, on a camera set like this, because people have to go to the hospital, see a clinical psychologist, and they have an intervention called cognitive behavioral therapy that they will use to help you to get out of the trauma. In that intervention, they will look at your cognitions, the negative thoughts that you've developed as a result of the traumatic experience that you've gone through. When people go through trauma, they develop negative thoughts about themselves. They are not worthy. They are not going to be great. They will die. They will be losers. So it will deal with that. It will also deal with the bad behavior that you've developed because of the trauma. Some people develop addictions because of the traumatic event that they've gone through. Right? So then you need CBT or cognitive behavioral therapy to help you to work on those behaviors and help change them, as well as changing the negative thoughts. The negative emotions that people also develop because of the traumatic experience that they went through, which is depression, anxiety, stress, the cognitive behavioral therapy will also help in terms of dealing with these negative emotions, which is depression, anxiety, stress. Right?
Yeah.
So by way of the hospital, that's what they would do. Of course, in severe forms, trauma might require medication to help control trauma, but quite often therapy should be enough for traumatic, experiences, right?
Yeah.
Good. But on a personal level, what some of the coping strategies that people can do, I say that when you go through trauma, the first thing, many people go through trauma without realizing that they are even experiencing what we call trauma. That is the most dangerous thing when it comes to trauma.
Wow.
So the first thing is to come to the point of realization, the point of awakening that, hey, I'm experiencing trauma. And quite often the trauma figures who traumatize people, they are very smart, and they also try to manipulate you and deceive you to think or feel like you are not being traumatized.
Okay.
So if you go into relationships with people who are being traumatized, the one traumatized will make you feel that you are the problem. So in relationships, when people are being traumatized, it takes longer for them to come to the point of realization that, hey, I'm going through trauma, I'm being traumatized. A partner who is manipulating you, a partner who is gaslighting you, it takes quite a long time to know. So one, you come to the point of the realization or the point of awakening that what is happening to me, I am actually being traumatized by this event. Whether it's a chronic medical condition, whether it's a relationship that you belong to, whether it's a group or a church that you belong to, you come to the point of realization that I am experiencing trauma from this figure or from this event.
Wow.
Right? And that's a lot for people who are being traumatized when they come to that point of realization.
Wow.
That, hey, I'm experiencing trauma. Then you start looking for ways to get out of the trauma.
Wow.
Right? My next advice or my next tip on getting out of trauma is now, trauma happens within an environment. Trauma happens within a setup, a context.
Okay.
I say that if you are serious about getting out of the traumatic event or experience, move away from the traumatic scene.
Okay.
or the event or the area where you are going through the trauma, because it helps you a lot in that way.
Yeah.
Because the more you are in that environment where you are traumatized, the memories come up, and the more
The flashbacks.
you keep going down. So leave the trauma scene. If it's a relationship that is traumatizing you, if it's your partner that is traumatizing you, if it's a medical doctor that is always giving you scary messages about you dying because of your illness, stop going to that medical doctor, change that medical doctor, go to a different one.
Wow.
The point is that you have to leave the trauma scene or environment where you are being traumatized. That does a lot for anyone who is trying to recover from trauma.
Wow.
Right?
Yeah.
Now, the other thing you can do, another important thing that a person can do after moving away from the trauma, is now to examine the negative thoughts that you've developed because of the traumatic experience you've gone through. Whether it's sexual abuse, whether it's being beaten in a relationship, whether it's being manipulated in a relationship, whether it's a boss that was traumatizing you in the workplace. Now you need to look at the negative thoughts that you've developed because of the traumatic experience that you've gone through. List them down, look at them critically for yourself, and now you begin to see how bad those thoughts were. That I can never be great, that my boss said I'm lazy, I cannot make it, or if it's a parent that was traumatized, there are some parents who traumatize their own children, and they can tell you, you cannot become great than me, you cannot become this person, and so on and so forth. You now have to look at all these things, the negative thought that is giving you, thinking that you cannot become that, you cannot do this, you cannot do that, and now tell yourself, I can do it.
Okay.
You are not good at this. And now you change that thought to, I am good at this.
Wow.
Right? Changing negative thoughts that came to you as a result of the traumatic experience is another important step if you want to get out of the trauma.
Wow.
I'm not done yet.
Okay.
But if you
sure. But it's not to cut you short, Dot. You mentioned about the fact that, parents usually instill more negative statements in their words. Yes. So could that experiences account to why people grow up with low self-confidence and low self-esteem?
Of course, if you have a narcissistic parent who is always comparing you to themselves, they give you a lot of negative messages.
Okay.
And that can be very traumatizing. Given that we all come into this world looking up to our moms and dads.
Wow.
Right? And if the one that you are supposed to look up to, who's supposed to be the number one person encouraging and supporting you, is the one undermining you, that can be very, very distressing and very, very traumatizing.
I see.
Right? And as you grow up, as you try to get out of this trauma and redefine yourself, reinvent yourself and become great, you need to do away with all the negative thoughts that they've put in your head about you cannot become this, you cannot become that person, you cannot become great, you cannot be better than me. Throw it all away and start believing in your potential, God-given potential, that I can become this, I can do this, I have the potential to do that. Right? So back to the point on the ideas on how they can get out of the trauma. After dealing with the negative thoughts, now we are focusing on how do you heal your emotions.
Okay.
Let's talk about sleeping, making sure that you are getting adequate sleep at night between 7 to 8 hours. Sleep is a healer. One of the best healers in the world is sleep. Right? It helps us to heal our emotions. All the things that are painful to us. When we go to bed, we sleep deals with them for us.
Wow.
So sleep has been shown to help people deal with depression, anxiety, stress, or have a better feeling or emotion about themselves. So make sure you prioritize your night sleep if you are trying to heal from trauma.
Wow.
What about exercise? We know that exercise has been shown to be one of the things that help us overcome depression. Quite often people who are traumatized experience a lot of depression and sadness in their lives. You need exercise to help boost your mood and start giving you good feelings, because exercise helps you to release positive chemicals within your body, which makes you feel good.
Wow.
Exercise will help you regain the confidence. When you run, when you try to give yourself some meters to run, and after conquering that, you get some confidence in yourself.
I see.
Right? Another thing they can do is also to try and boost their self-esteem. Changing the negative thoughts, of course, will help them in boosting their self-esteem, because when people want to lower your self-esteem, they give you a lot of negative messages of things you can't do and what you cannot become, and so on and so forth. So there are a lot of things that can be done, but these are some tips. Of course, if they want more, if they are being traumatized and they are unable to do it, they have to see some of us clinical psychologists. We can help them. But these are some tips. There's still more to say, but hey, I'll leave that to you too.
Wow. So that means that trauma can be very destructive, not only to your mental health, but It can be triggers to a whole lot of diseases and illness in our well-being. So, Doc, we want to have your last words. What is this special advice that you can give to the world out there watching us, or individuals who are experiencing trauma, or who are not in the position, or who are not even in the state of experiencing trauma? What advice can you give to us that we can be very cautioned as far as trauma is of concerned?
Trauma is a very dangerous thing.
Yeah.
Most of the diseases of this time, the root cause can be traced to trauma because it disrupts you both, psychologically, emotionally, and also in terms of your physical health. So let's do our best to get out of trauma with some of the steps that we shared. If you are still struggling, go to a hospital, see a clinical psychologist, let them help you to get out of trauma. And you begin to see new perspectives in your life. You begin to get some new confidence in your life. You begin to feel very powerful in this life because trauma will make you feel undermined and will make you feel that you cannot become the potential that God has asked you to come and be upon the face of this earth.
Wow. Wow. Viewers, thank you for watching us. On this episode, we've been talking about trauma, and a doctor here, Dr. Daniel Menza, has exposed us of what trauma is, the sources, the causes of trauma, what the effects that trauma can bring upon our well-being, and the interventions that we can adopt to mitigate the problem of trauma. If you didn't hear anything at all, at least you heard that trauma is a very destructive thing to our well-being. So protect your well-being and protect your health. See you in our next episode. Thank you.